I think Alberta's in a world of trouble.
The pandemic is at one of its worst points in Alberta. As we record high case counts day after day, we may look at other places worse off and breathe a small sigh of relief, but there is still reason to be concerned. As one professor points out, if Alberta had India's population, we would be recording hundreds of thousands more cases. However, Dr. Joe Vipond says with so many differences, he would be very careful about comparing Alberta's numbers to India. Instead, he points to another province.
Ontario has the same kind of healthcare system that we have. They're further along down the curve. They may have a slightly older demographic, which is putting them at higher risk, but we are no different from them. Even though we have an excellent healthcare system, it will be tried by this wave, especially if we continue to refuse to put in the appropriate mitigation measures.
And he expects ICU rates in Alberta to continue rising.
When the last set of restrictions were announced, it was 112. And after those restrictions were announced, real restrictions, not like the half measures that we have in place now, it still was another 3 months before the ICUs peaked at 151 cases.
He says while the direct comparison to India isn't going to give the most concise perspective, it does paint a picture of what we are hoping to avoid.
We just don't want to be India. We don't want to be Ontario. And that all the indications right now point that we're going to a bad place.
In Calgary, Jo Horwood, City News.